Sitting at the base of the Rocky Mountains, Fort Collins, Colorado is a city known for its culture of innovation and its abundant natural resources. Fort Collins is also a city of contrast. While there is wealth in our community, social, economic, and healthcare needs still exist. Public, private, and nonprofit organizations are working together to support Fort Collins' culture of health.
What's wonderful about Fort Collins is that we have a deeply engaged community. And I think that helps differentiate this community from many other places.
They decided as a government to partner with a nonprofit, UC Health, and a for-profit, which is Columbine Health Systems. And to have those three different entities that are very different come together has really been great. Everybody's very dedicated to making this work well.
Well, I think we are a very healthy community when you look at us from the outside. We receive awards for being a leader in bicycle and infrastructure developments. We are touted as one of the healthiest cities in America. When you take certain segments of our community, though, our outcomes don't look that way. When you look at our low-income community members, our Hispanic Latino community members, it looks a little bit differently, and we often forget about that section of our community and those important members.
Equity plays a big role in our work. The feedback that we've received from our participants through Vida Sana has been life-changing experiences. I really think that we kind of set the tone for what community health should be.
The program Vida Sana has been very unique because promotoras are going into the homes and one-on-one with the families, and it's more personal. The trust, building the trust with them.
You know, this is something that's important to us. And seeing the population come together in workplaces, certainly schools, and really advocating that this is something that they think is imperative to the success of their livelihood. So for example, to help increase physical activity, we've really seen a reduction in how many students bike and walk to school. So we're working with Kaiser Permanente and a Thriving Schools grant, and we have bike fix-it stations at all of our high schools and middle schools. And then we'll be applying for a CDOT grant to try and complete that project at all of our elementary schools.
Fort Collins has for years had a very progressive tobacco policy, and it started with smoke-free restaurants. It expanded to outdoor dining areas, and now we have smoke-free parks and trails. And as a result of some of our initial efforts, tobacco use rates in Fort Collins are some of the lowest in the country.
So by being in the city's community centers, the senior center and others, we're able to take the expertise of physical therapists, or the expertise of physicians, or even holistic practitioners, and bring them here and make them much more accessible to the community.
So these are all things that make our community unique and are successful strategies for gathering more health information and looking at all the systems in our community and how they interact.
It doesn't matter who gets the recognition. If we're raising the graduation rate, if we're improving community health, if we're eliminating poverty, increasing affordable housing, you know, all of those things, that's, you know, everybody wins, and we in turn have a more vibrant community.
Fort Collins' greatest strength is its collaboration among partners to support community health. These efforts focus on policy, systems, and environmental changes to make the healthy choice be the easy choice for all who live, work, and play in our community.